So first, to complete an application, you will need information about your organization's signed data sharing agreement. So as mentioned in video 2, the number one first eligibility step to applying for these grants is ensuring that your organization has signed the data sharing agreement. To then complete your grant application, it will be really helpful to know who signed it within your organization and when. So first step, I would encourage organizations to get that information, connect with whoever it was. Maybe it's the CEO, maybe it's a health IT manager, maybe it's legal counsel who signed that data sharing agreement on behalf of your organization. Additionally, the grant application also asks for details regarding the geography and the population served by your practice or your organization. It will also ask about prior health IT funding you may have received. So for example, if your organization participated in the QHIO program or other state-funded programs to increase data exchange capacity over the last few years, the application will ask about that. It also asks about your current EHR, if applicable, and your current state data exchange capacity. So what is data sharing looking like in your organization right now? This information is really important for determining the funding amount that your organization can apply for. So there are baseline funding amounts for each type of organization that might sign the data sharing agreement. So for example, a physician practice, the baseline funding amount is $35,000 for a grant. However, if your organization qualifies for enhanced funding, the grant amount bumps up to $50,000. And the enhanced funding is available to organizations who serve underserved communities, either by being located in a zip code that falls in the bottom quartile of the California Healthy Places Index, or by serving more than 30% of patients who are enrolled in Medi-Cal, underinsured, or dually eligible for Medi-Cal and Medicare. So if your organization falls into those categories and you did not receive any of that prior health IT funding like the QHIO program, then you could be eligible for the enhanced funding amount. So it's really important to detail that in your application. You know, who are the patients that you're serving? Where are you located? For the technical assistance grants, you will then be asked to outline your planned use of funding and describe how your budget request will enable your organization to meet the data sharing agreement requirements. So what exactly are you going to spend this money on, and how does it enable your organization to build up a stronger data exchange infrastructure? Examples of what could be funded by the technical assistance grant include updating or upgrading your EHR system. It could include conducting an assessment of your data sharing processes and your systems to help identify gaps or opportunities to build capacity. Funding could include designing workflow or systems changes, and it could also include training staff on new workflows or technology solutions. If you are looking at the QHIO onboarding pathway, examples of what could be funded is much more specific, right? The QHIO funding pathway can only fund connecting to a qualified health information organization, and the grant dollars will offset those initial onboarding and connectivity costs. You can find more information on California's data exchange framework at familydocs.org/DXF.